gonna be here today.
Yeah.
Thanks, Brandon.
Good as that. I am after the sun.
Thanks, sir.
Yeah.
After the sun.
Started.
Let me get my chair out here.
Schedule something.
Are you gonna need your mouse?
I am not.
Thank you.
Oh, it's been
I know that was not a.
Water.
Perfect.
I know. I get it.
Yes, space.
Are we live? Fantastic. All right. Call this meeting of the Crawford County Commission to order this 11th day of December 2020. Please join me in the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Having looked over the agenda and minutes from last meeting, are there any corrections or additions?
I will move that we accept the minutes from the previous meeting.
Second. Moving on then to signing of the motions.
We have several motions from the last meeting to sign. First motion is 20-482. That's consent agenda to be approved. The next motion is 20-483 to approve the emergency shelter grant CV2 application and authorize the chairman to sign. The next motion is 20-484 to approve the motion of recommendation for a subdivision to be known as First Replat of Trowbridge Estates, Second Edition, and to rezone the property from agricultural to rural residential as recommended by the Crawford County Zoning and Planning Board. The next motion is 20-485 to approve the November 2020 clerk's report as presented on a roll call vote. The next motion is 20-486 to approve certain malt beverage licenses for 2021 for Pickler's Chicken Annie's for sale in original and unopened containers and not for consumption on the premises. Also for Pickler's Chicken Annie's for consumption on the premises, and for Pizza Beery, located at 1100 West Highway 400 in McCune, Kansas, for sale in original and unopened containers and not for consumption on the premises. The next motion is 20-487 to adopt resolution number 2020-013, a resolution closing and vacating two platted alleys in the Western Coal and Mining Company subdivision in Crawford County, Kansas. The next motion is 20-488 to approve the agreement between Crawford County, Kansas and First Call of Kansas Incorporated for transportation of bodies for medical examinations authorized by the county coroner and authorized the chairman to sign. Next motion is 20-489, to approve the publication for the 2020 budget amendment for Crawford County and to set a hearing date of December 22nd, 2020 at 10 a.m. The next motion is 20-490, to approve the publication for the 2020 budget amendment for Crawford County Fire District Number 3 and to set a hearing date of December 22nd, 2020 at 10 a.m. The next motion is 20-491, to recess this open session and go into a closed executive session for a period of not more than 15 minutes to discuss the noxious weed department under non-elected personnel and to include the Board of County Commissioners and County Councilor Jim Emerson and to reconvene by 10:55 a.m. And the last motion is 20-492, to recess this open session and go into a closed executive session for a period of not more than 10 minutes to discuss the county barn under non-elected personnel and to include the Board of County Commissioners and County Councilor Jim Emerson and to reconvene by 11:05 a.m.
Busy day. Thank you, Don.
You're welcome. Thank you.
All right, moving on to our health update with our health officers.
Chairman, do you want to give the gentleman, let him speak first before Doc gets up?
That'll be fine.
Did you want to,
Sir, did you want to
Mr.
address
Burns, did you want to come up and?
If I can do it after the first,
That's fine.
that way they may answer some of my questions.
Okay.
Okay.
Good morning.
Good morning, Commissioners. So update for today, she's handing out our grading criteria and the current stats. We'll go over where we are at currently. Ascension View Christi, currently 18 positives with 1 PUI in the hospital. We have 10 patients on vents. I believe 9 of those are COVID. Girard Medical Center has 4 positives, no PUIs. Staffing, bed capacity at Via Christi is a concern. They're managing that. Girard Medical Center has more openings, and the hospitals are working together for appropriately managing that within the community. I will add, EMS has had a significant increase in COVID cases that we're managing. Most are related to two of the local nursing homes that have a significant amount of effect, but also within the community. And so we are seeing quite a few COVID-related calls, especially over the past few days. Not overwhelming our system, but just so you know that that has increased within our system. And actually, that would be expected given the current numbers. This week thus far, and this is as of 5 p.m. yesterday, 194 new cases. We will go over 200 again this week. Last week we ended with 293 cases and a positivity rate of 30%. We're running about 25% this week. That's on line with what we've been doing essentially since November 1st. Currently we have 388 in isolation, 1,940 in quarantine. We are now at 23 deaths, with 3 new deaths this week. Actually 5 in the last week, yeah. 8 long-term care facilities involved. Schools still doing relatively well, with 46 total in isolation. That's 21 staff and 25 students. Quarantine has affected 30 staff and 329 students. We have, just so you know, before we go to the gate criteria, CDC and KDHE have adopted new quarantine guidelines, which is a reduced quarantine standard from the 14 days down to a 7 or 10 days. Well, it says 7, but really it's 8.
You're out on day 8.
Out on day 8, yeah. So if you are on quarantine, you can elect a test after day 5, and with a PCR test, if that's negative, we can release you after day 7. If you opt to not test with a PCR test during your quarantine period, we can release you at day 10. CDC put that option out, and KDHE adopted it in that the local health officers can adopt that standard if they approve it for their county. Looking at our data with respect to numbers of positives in the greater than 7 to 10 day time frame, that was a low number of concern for us. That weighed against the idea that we believe more people will test and accurately give us information with respect to contacts. If they know that the quarantine is a little less restrictive, we think we can get a better handle of who's actually positive in the community and get a better idea with respect to tracing. And so that benefit we think outweighs the risk of releasing somebody early. Obviously, we still have the recommendations that they monitor through day 14, as well as everybody should monitor daily anyway, and be extra vigilant with mask and understanding their potential for spread, that they still could get COVID-19 from that initial contact up to 14 days later. We sent that standard out to all health entities, schools, and we're following that within our health department.
There are some exceptions.
There are some exceptions, thank you. That's why there's 2 of us here. 2 exceptions, 2 notable exceptions. 1, any correctional facility, that doesn't qualify. And 2, any long-term care facility, we still do the 14-day quarantine. And we think that that's appropriate, and we will follow that as well. Those are the higher risk. We have seen more concerns in those populations. So
I'll also add that that's county by county decision, and the majority of the counties in our region have not opted at this moment in time to do the 7-day with a test. I think that's more for logistical purposes. The majority of them, and I'm still waiting to hear back officially from some of the counties, but I know Bourbon and Labette are just starting a 10-day quarantine. They are doing the 10-day, they're just not yet doing the 7-day. So that may affect a lot of people that are employed in Crawford County but live in another county. So just so you're aware, that's county by county decision.
it does create some potential for confusion, but again, as we looked at the risk and benefits adopting that program, we think the benefits outweigh the risk significantly enough that we opted for that change.
Okay.
When you say that they had not opted into that part, the 7-day for logistical reasons, are you meaning because of the increased testing that would?
Well, and having to
accompany?
manage that. So as opposed to, you know, letting them know that they are out in 10 days and what that date is. If it's a 7-day, then they have to confirm a test and all of
Right.
that. So it's more,
And we've added extra processes in place where, and Samantha, you're on, please verify that we have that survey link in place. It is, okay. So
Yes, the survey is posted. And we also, so it's on the website and it's on all the social media pages right now. And we've gotten a lot of responses so far within the past couple of days. So people are seeing that.
Good.
So what that process is if a person in quarantine is wishing to be tested and released at 7 days if they're negative, they can go to the link and there's a form that they can put their demographic information, attest that they have been asymptomatic, and then also put their testing date, what their test was, and where they had that to help with the confirmation. And then they will receive an email, if they have an email, for more prompt, timely responses saying that they are released on what day. If they don't, then it'll be mailed to them.
So it allows us to use information technology to help us flow this process versus boots and fingers as far as, you know, managing it through our personnel. So we think that that's going to work well, and I think Janice was indicating that it is, so that's good. I'll let you go through the gate and we'll talk about where we're.
I think pretty much everything on here has been covered. The only thing you didn't mention, I think, was the breakdown of our new cases. Still primarily in that 25 to 65, over 65, with an even about 25% in each of those categories. So 75% of the positives are in that older group, much smaller amount in the school-aged. Overall, the trend is stable, if not down a little bit down from where we were at this time last week. So that's positive. That's positive. The other thing I'll mention on the school gating criteria, we did take off the little note about no confirmed cases as a result of in-class spread, because we have seen some. The caveat to that, though, is those were in classrooms or situations where mitigation strategies weren't followed appropriately. So the schools are definitely working with their staff and their students to ensure that those are continued. And we met with the superintendents and feel that when those strategies are in place, it really does work. And if anything, then these cases have confirmed to us that when masks are worn and distanced when possible, and the hand hygiene and all of the things that the schools are doing, it really is keeping it from transmitting in the classroom. And our overall numbers in the schools are lower than they were last week. We continue to feel very strongly that schools are a safe place for both the staff and for the children, the students. There's no guarantee that there's not going to be in-class transmission, but the reality is if we were to close schools, those students would be out in the community more, and also not getting all of the benefits of what school offers. The social support, the teaching and learning, sure, and nutrition and safety. So we continue to feel very strongly that school, in-class school is the safest and most beneficial at this point.
And that's backed up not just with us, that's backed up through multiple organizations, including in Kansas, the Pediatrics Association, also through the Kansas Work Group for Kids, Kansas COVID Work Group for Kids, and CDC. And so, you know we have risk in everything that we're doing, and all of these risks, we weigh risk and benefits, and look at the current data trends in our community and apply that to the safety standards. And so with schools, it's clear looking at the data that the kids need to stay in school, as long as we can logistically support that. And again, our greatest area of emphasis would be elementary, but overall all schools. So we'll continue to work through that. And we do have some cases that we're going to look at that I just found out about right as I was walking in this meeting regarding some possible transmissions related to sports. So we'll look at that a little closer. And otherwise, we're still following the CASHA guidelines, and we think that that's appropriate. The other main thing that was discussed this week with the schools at the superintendent meeting was regarding the Acacia update and spectator sports, which essentially said their guidance was for each participant, and they had a list of participants, you know, the athlete, the band, the cheerleaders, the photographers, the press, any of the student participants, potentially, or they would say that you could have 2 tickets per student to view the event. We further clarified that in addressing that, stating that yes, but to a maximum of 25% capacity of that gymnasium, seating capacity. And so if Acacia is more restrictive, we'll follow Acacia. If the 25% capacity is more restrictive, we'll follow that. And so it was either or, but the most restrictive. We also recommended no concessions, just because people then they have to take down their mask to eat, drink, etc. But gave some guidelines in case they opted against that, which I don't think any system is. I think every system
Because actually
is.
the superintendents
Yeah, they were.
preferred that.
Yeah, they were most concerned about that. And we agree. And so,
I assume, Doctor, that if someone is in the stands, being that we're moving along with Acacia, if they don't have a mask on, they will be asked to
they
leave.
will be asked to leave.
Okay.
No. So the guidance from us and from Acacia is that if you are in the building at the event, you will wear your mask, or you will not be in the building at the event. It's pretty simple.
Pretty easy.
Yeah, and there's really no reason to, you know, for somebody to fight that. I mean, just wear your mask, watch your kids, right?
Right.
And then go home.
Pretty easy.
I think one of the things that I would like to mention, just because we've gotten some comments from concerned individuals in the community, as well as kind of looking through the survey that we did on people's perception and feelings about everything. Some of the comments that we see is the concern, especially, you know, this week where we've added 5 deaths, which has always been our, you know, big concern, that and our healthcare system being able to manage patients, being linked to us continuing to endorse in-person school. And we look at this very closely, which is why we separated it out. I just want to comment on that because unfortunately the rise in number of deaths, the burden on the hospital is just a result of the number and the amount of community spread that we have. There is not a link to that spread coming from the schools. There's not a link to the individuals that have passed away having any link to the school. And just looking at the numbers and the trends that we have looked at for months, it is kind of the knee-jerk reaction across the country that the first thing that you do in response to rising cases is to remote learn students. They're in this region, in the rest of the country, there is not data to support that is going to significantly decrease the community spread. We know that the community spread is primarily from home contact and social contact. It's not coming, even though there may be some cases that come out of the school, the amount of transmission, and if you just look at the number of, 7 new elementary students this week and 14 new high school and middle school students this week compared to the 194 new cases that we had total. And those are generally from home exposures or social exposures, and no deaths linked to anything school related.
Right.
And so that, I just want to be transparent about that because it is something that we look at. And we've always said that if we had any concerns, or if the schools had any concerns about transmission being a contributing factor to our community spread, we would look at that differently. And we still remain very confident that having the students in person is best.
And we're working very closely with the administrators weekly or daily in evaluating these cases. And the school nurses, the school contact tracers, our epi nurses and contact tracers are working definitely daily, multiple times daily, to ensure that we have an idea of what's going on. And, you know, the biggest, most important thing that has to happen in every school system, and really what we've been saying in every part of the community, is appropriate use of the mitigation standards, because those are effective. And where we don't do those, we see spread. And, you know, we can continue on with everything that we're doing if we were to do that right. The problem is, not everybody is. And so, we still fight daily, personal opinion, politics, and emotion in managing this COVID crisis. And we don't use any of those. We don't, except for we have to fight it, right, in answering these questions. But we use current science, current data, and common sense, and we stick with that. And the current science says mitigation standards are appropriate and beneficial and reduce transmission in a community. And where they're not applied, transmission increases. That's science. And so we ask still and continuously from June 19th that the community embrace that. So moving on to vaccination update. The FDA approved the Pfizer vaccine for emergency use authorization yesterday. It still had an additional step through one final approval. That being said, the distribution systems are already cranking up. That will go through the medical center chain first to get the high-risk providers, mainly or notably ICU and emergency departments, but we're working on all providers. Second primary would be long-term care facilities. Some of those are going through their medical chain partners. Some of those are going through health department and local pharmacies. Secondarily, the community medicine and community at risk, that will be through our health department and pharmacy partners, and that process is cranking up now. And so I anticipate as early as next week, through some of our medical chain and systems, we will start to see vaccination of our providers, our high-risk providers. And so more to come on that, but the process is flowing, the train is moving, and so
Good.
I anticipate we'll see that. The other thing that we wanted to bring up, which is, I think, very beneficial to our community and potential having a positive impact on this COVID crisis, is we now have in place a process and are administering the monoclonal antibody, bamlanivimab now is what it's called, I believe, BAM. We just call it BAM. It's got a lot of letters, a lot of vowels. It is a monoclonal antibody that is utilized to fight the virus. It was specifically designed to counter the virus. We are given doses from the state at both Girard Medical Center and Ascension Via Christi. I think we are at 6, or will be at 6 infusions already this week. That is for our high-risk group, the high-risk group being age 65 and older. We have additional high-risk groups that are secondary priority, and those include those with comorbidities, including obesity, diabetes, kidney disease, heart disease, lung disease, etc. We can give that down to the age of children in the right high-risk group, 12 to 17. Again, the process is in place through Via Christi. Dr. Bean and I are managing that with their pharmacy and medical providers through Girard Medical Center. That's Dr. Garner. And we're hopeful that that can have a positive impact. Currently, we have 40 doses available in our, 34 doses available in our community. And we'll continue to work through that process to decrease our numbers. And knowing that our high-risk group is that 65 and older, especially obese diabetics, we think that that can have an impact and potentially, hopefully, reduce hospitalization, which reduces our community impact overall. This is just a stabilizer between now and full vaccination of our community, but it is a piece that actually helps, right? We think can be very beneficial to reduce the severity of illness in the high-risk individuals. And so,
One thing I might mention, again, this is for outpatient only. It's our only outpatient approved treatment. And there's a time sensitivity to being able to administer it. So definitely encourage people that are at risk for severe disease to contact their primary care early if they are diagnosed with COVID, because it's for mild to moderate illness. They don't have to be severely ill to be able to get it. Our hope is that if they get it early, it would prevent them from developing severe disease.
and in fact, if they have severe disease with COVID, we can't give it because it can make it worse. And so this is one more reason to get tested if you have concerns, especially in those higher risk groups. So we can catch that early and get you access early in your illness, because once it switches over to a more critical aspect, you're outside the window. We have 3 days. And we can extend that a little bit and will, but we want to get it within 3 days of the positive, and so we need people, especially high-risk people, to get tested so we can even access that.
Doctor, when you say you need them to test, are you do they still need
They're
to
sick.
they have to have a symptom, right, to be tested?
No, anybody can be tested at this point, whether they have symptoms or not, but it would be symptomatic people that would, mild to moderate illness.
Okay.
So that does mean that they have symptoms. Sometimes what happens though is people get tested, they don't feel terrible, so they kind of wait it out. And remember, at 7 to 10 days, those that go on to develop severe disease is when that happens. And so we really want to get them when they don't feel that bad, but they have risk factors for developing it. So letting their healthcare provider know so they can talk about that's important.
And I can tell you, we have diagnosed COVID multiple times on patients that have come in that have been feeling bad for a week, that didn't get tested, and now they're short of breath and requiring oxygen and have COVID pneumonia.
Or people that get tested and then they go home and wait, because there hasn't been a lot of outpatient options. But this is a shift in that, and, a lot of people are tested at freestanding, curbside or, so their provider may not quickly see that result. So it is important that if they know they're positive and they're at risk, and Samantha, I think it would be great if we could kind of put just a very brief bulleted who would qualify for those so that they can let their providers know. That will help us to get them access to this quicker.
A couple other things, we are reworking our information flow through our county website to help ease the burden of finding the information. Unfortunately, we're all probably suffering a little bit of information overload and trying to find the places that are valuable versus alarmist or, and quite frankly, inaccurate or dead wrong. And so we're trying to realign that. Samantha is working with our county team to get that in a better format so it's a little easier to find. The last thing we bring up is community-based testing. The Well Health folks are active and running at the Bicknell Center now. We've added a test site at Countryside Christian Church parking lot.
This morning?
That is up and running. I don't have the numbers for today. Yeah, and so I know they tested a large group yesterday, and so,
58, more than
On Wednesday.
yeah, on Wednesday, yeah. And so they are starting to work, or not starting, we're all learning this new process, and so, but we are getting information flow from them as far as numbers tested, et cetera, and that helps, but gogettested.com.
Right.
Is the access point for this region. That's for all of them, but that'll get you to this regional aspect, and then you can set up your time for testing and get that done, and it's free to anybody that wants to get tested, symptomatic or not. Certainly, we want all symptomatic people to get tested, but any that want to.
And it's a really good option for those that are wanting to be released from quarantine after the 7 days.
It is a PCR-based test, so it's a saliva test, which is helpful. You don't have to have anything stuck up your nose, which appeals to many people. And high sensitivity, accurate, and free. So that's good too, right?
And how long will they be conducting testing?
Well, they're here through the end of December, although there's talk at the state level that they're going to try to extend that, but that all relies on CARES Act money and processes, so at least through December. That helps us, right? That does, we'll take any one of those that we can get, and so to maybe settle this down in the community. If we can find and isolate those that are sick, and if we could get people to follow the mitigation, I think we'll have a much better handle on this. We do have concerns. The Thanksgiving concern showed up last week as we had expected, and still here this week. We still have the Christmas mixing concern, and so we want people to celebrate, but we want them to do it safely. We've put out those standards or recommendations and asked people to consider that, at least this year.
You might point it back to your video that you produced at Summit County website on how to celebrate holidays.
Yep. So we did do a PSA. It's a video PSA that discusses safe holiday celebrations, and also discusses the current situation and future outlook. And so it's not that long. It is pinned on the county website, and I encourage you to watch that as well.
Do you think that's something we need to try to get on television, or?
Samantha was working through that, and we did and have. I don't know that it's got on television, but I know that it was blocked on Facebook because it came up as a political ad.
Thanks, Facebook.
Yeah.
But it should be reapproved hopefully soon.
Thank you.
Do you know at the testing centers that are currently set up, do they have to go to the website to set up a testing time?
Yes.
Okay. I didn't know if they could just drive in.
And to get their results too.
Yeah.
So they do need to have a capability of doing that.
And when you're talking about, I mean, I don't know how many they can test per day, but you can get a lot of tests in there. For the information flow and to manage this effectively, we have to have the participants help in that. And that really is getting their information in. And so we did that in our family. It worked very well. The test was easy, the time slot was perfect, and the results came back in 48 hours. And they even send you the copy of the negative result, which was helpful, so that we could turn that into the appropriate people. So,
Yeah. As far as the results thing, going back to the changed quarantine procedures, so you said they enter into the form if they've had the test or not. Do they have to provide verification of said test, like a copy of their results or something?
Technically, they don't, because the health department has access to that through the EpiTrack system.
Right.
I think there were a few delays, or there have been a little bit of delay in that. So I think Samantha was going to try to arrange it so a person could upload their result, just for timeliness, because if the health department can see it there, verify it, then they can instantly send out an email and they're done, which everybody wants,
Right.
things done timely.
Efficiency,
So
sure.
we're trying to make it as easy as possible for the person submitting the test and for the health department, so.
Yes, they do have that option to upload the results at the end.
Awesome.
We tried to make this as easy as possible, and through our thought processes and game planning, we think we have a process that's effective. We're putting it into practice now, and if there's hiccups, we will adjust, but I think it's working pretty well.
Good.
The release of warranty recently.
I had a couple of questions that are kind of all over the place.
Sure.
On the gating criteria, one of the questions I've gotten is breakout of staff numbers from student numbers. So right now, in here, there's just for the school, but then you had mentioned in the comment that it was 21 staff and 25 students. Is there a way that we could just like add a line down below the age groups that have the number of staff?
Yes, it would spill over. I like it on one page.
Formatting.
Yes.
That's
Formatting
fair.
reasons,
That's
but,
fair.
Maybe we can actually add the line right there, because that'll.
I'm gonna say in that bigger box, might
Yeah.
be possible to shrink the
Yeah.
text to
You
11.5.
got the 0 to 9 to 10 to
it's supposed to be
17.
12.5. Let me see what I can do.
Okay,
Yeah.
it's a question I've gotten a lot, and I thought it would be
Yeah.
reasonable to have that separated. so-
Yeah, again, though, data, just looking at it without understanding the context, because, I don't want people to assume that those students or those staff, that means that it came from school, because again, the majority of it is from home or social exposure, so, but yes, I will see what I can do about getting it to fit on there.
And we also have to understand that in relationship to the population. And we have 6,700 students in Crawford County.
Yeah.
Right? And so when you calculate out that population, that gives it some greater clarity versus 25 in, one school.
Right.
Right? And so this is across the entire county.
Correct, sure.
The other thing I just want to mention on that note with the gating criteria, because I think we've also heard comments about updating more frequently and all of that. The gating criteria is really look to allow for us, and we want to share that with the community, what the trends are looking like over the past 2 weeks. So the gating criteria, when it originally came out to help guide decisions about school and decisions about restrictions in the community, was really, it's a 2-week trend. And so, from day to day is not necessarily helpful, because our numbers at the beginning of the week will look very low. It's really more the trend. And so even from when we present on Fridays to the following Friday, I have to update that middle column, because things change from after today through the weekend numbers. So really the goal of this is to look at what our trend is, so we can help anticipate, as we have been, always looking that 2 weeks down the road or that month down the road about what we think it could potentially happen. It's just a tool to help guide. It is not a hard and fast, real-time, moment-to-moment
Right, it's out of
decision-making
date
thing.
the second that comes off the printer.
It's probably already, yes, out of date,
Right. Okay.
so.
So a couple more things. How are we on contact tracing? Where are we at with that? And I don't know if that's Janice's question or if that's...
Probably more of a Janice question. We did move it out of the red and into the orange, and we probably could have done that last week too, because I think that they have been managing locally for the last few weeks. Early, it was out of necessity because we didn't have KDHE's ability to help. But I do think that she has indicated that they are able to do it. It is still in the orange because it is a lot. And so, you know, but they are managing.
The additional tools that we put in place though to help us manage this and the decreased quarantine requirements actually benefit us in managing this. And the other thing is, just like every industry, including here, COVID has affected us in our setting as well. But now we've got recovery and staff back, and that helps, right? And so we're able to manage that a little bit more effectively. You know, we watch that day to day. We watch that week to week for sure. Through different organizations in the community, including the task force has a subcommittee on helping us if needed. That stood up, it's there, it's a potential if we need to add contact tracers. We think we got a funding source to potentially help us if needed. What we don't want to do though is put that in place and add an extra level of management and another group that we have to train to say the right thing. So, you know, we don't want to
Create more confusion.
in the community. And so it needs to be employed appropriately if needed. 2 weeks ago, much higher need. This week, we're managing a little better, and we can do on-site management with our, heavy nurses and contact tracers to effectively communicate to the community. And so we'll keep it in that realm at this point with the backup plan of further assistance if needed.
Well, so regarding that with the messaging, because the school nurses are doing that to some extent, right? The contact
They're
tracing
assisting the health department on
portion.
some of that as far as school contacts, not
Not
outside of
Correct,
the school
right.
setting.
Is there something in place to ensure that consistency?
Aside from the hours of training and months of work.
The main thing for consistency is that we're doing it locally. And actually, that is one of the reasons that we were able to immediately go to utilizing the 7-day with a negative
Right.
test on the quarantine release, because we're managing it all locally. The other health departments, the biggest reason why they say they can't do that is because they have KDHE continuing to assist with quarantines, and they are not in a place where they're going to start doing that yet.
They haven't even been able to update their computer standards to manage that. And I didn't mean to be quippy with that, I apologize. But
That's all right.
But the truth of the matter is, I mean, they've all been trained and we're working with them day to day and have been on those standards, not only the nurses, but the administrative component to work through that. So we think we've got a pretty good process in place for that.
We have Excel data sheets for all the schools that, they send us those contacts and we can initial when they're out of quarantine and that type of thing. So I think
That's
there's some
shared
good
between the two
communication, shared
entities.
document
And that's
that we-
literally updated real time.
Correct, right.
So we're able to follow through on that, so.
Okay.
Great question, and the hard part for our job is, we have a lot of processes in place, a lot of things that we're doing to manage that. And as a part of managing that, we don't always communicate every step that we do, which would really bog us down to the point of ineffectiveness. But it is a great question, and we need to respond to that appropriately if the concern arises to say that we have that process in place. Or there may be times that we find that we need to adjust things, and so we welcome those questions.
Okay. And then lastly, I know that we've gotten the enforcement process underway. Do you want to give an update on kind of what that looks like?
I will, although I'll have Jim work with us on that. We have done checks at facilities and I have found failures. Letters went out Wednesday?
Wednesday.
Yep, to the facilities that we know have failed to meet the standards with the listed requirements and appropriate ordinances or statutes that govern that. And I'll let you talk about that in a second. We have taken some additional steps. As I told you last week, I would go through Walmart and Home Depot to discuss with them the concerns. I did a site visit with all 3 locations on Tuesday. Spoke with the managers. We walked the stores, discussed their policies and procedures that are in place for both their employees, for their check-in process, as well as the procedures for store cleaning and mitigation to prevent spread from incidental contact. I will tell you, all 3 organizations, well, 2 organizations, 3 locations, have a robust plan in place. They went so far as to take me into their break and storage rooms to show me the supplies that they have available. Home Depot specifically has, they call it their 9-box plan of how they evaluate and manage in their store. And you guys, if you want to look at that. Walmart also has a robust cleaning policy where they are, cart cleaning nightly and multiple times throughout the day. They have hired additional maintenance personnel just to go around the store and wipe off door handles and countertops. They have, their checkers are always wiping down the computer stuff that are cross-contacted. Now, I will tell you, they don't have, nor do we have anywhere in the world, perfect compliance with masks. Meaning, as some of them are talking, and we've all suffered this, as we try to find a mask that fits our face, as you talk, as you move, the mask will start to slip down. And part of it, I think, we wear these so much now that you don't even realize that it's on your face. And if you've ever tried to take a drink with your mask on, then you'll know that, you start to, and so, that being said, I also witnessed the managers walking around, looking at people, and then they put their mask up. I think by and large, on the whole, they are willingly working within their employee setting, and vendors, by the way. We did find one vendor that had walked in, and the manager was very direct. You need to put your mask on. And the vendor, totally apologetic, as you're mission oriented, was like, oh my, and just grabbed his mask and put it on real quick, and again was very apologetic. And so I think they're doing the right thing. It's not perfect. I did see community members come in with a mask on and then go into the store and drop their mask. And I don't get it. But the main concern from all 3 managers was, what do we do with that, right? And, as far as the confrontation and legality of enforcing that. Now, they all do offer free masks. They all do have hand sanitizers at the front door. And they all are encouraging as far as, please, for the health, risk, safety of the public, for our staff, for us to stay open in the future, please put your mask on. And some people are doing it and some people are not. And, that actually comes back to us and you guys as far as, are we going to hand out tickets to people if they don't have their mask on? And the governor's order is what dictates that the most, but with a challenge with enforcement. The cities themselves can ordinance that. I think we have a little bit more challenge at the county level doing an ordinance for that. So for our standpoint though, we want the public to wear their mask. We insist that the organizations and their employees wear masks. That is a population we can and do control. And so, and that's where the greatest risk is. If we have a cashier that's sick and has 100 checkouts during the day, they have 100 potential contacts. If you have one person walking through the store without their mask on, especially when you're getting only about 15% capacity. Home Depot's a little different. They can get up a little higher in capacity, but the Walmarts, and they're doing their counts, they're 15, maybe 20%. They're not getting close to the 25%, certainly not anywhere near the 50% capacity number.
Doctor, do you think it would be a benefit, or to ask our cities to pass an ordinance?
It would, if you're wanting to get to the level of the person, I think and Jim would probably say this, you almost are going to have to, if we're getting down to the person. Now, then the cities would have to enforce that with their local law enforcement, and I think their local prosecuting attorneys. I'm getting out of my box though, and that's more into Jim's box, and so I would defer.
Okay. Jim?
Yes. And you're a little out of your box, but you're exactly right. If we're looking at the individual, we will be looking more targeted at the cities to adopt an ordinance and run it through their municipal court. If we're focusing on the businesses, which we have decided to focus on, then I think the methods that we're using will work. But that's more for encouraging their employees to have the mask on, requiring that. And also the social distancing and some of the other measures that we have. So we're working on the two avenues that we've talked about here for the last 2 or 3 weeks. The letter to all the businesses, and I've worked on that yesterday with Samantha to clean that up just a little bit. So I think that's ready to go.
Well, I think Samantha had said it had gone out. Samantha, do you want to talk about that?
Okay, sorry about that.
Yes, it went out last night, and we've actually received a lot of positive feedback on that. I was telling Jeremy before the meeting, I received several emails thanking us for that information, that it was straightforward and to the point, and it was easy to understand. So that was really great.
So as part of our focus then, that's an item we've talked about quite a bit, making sure people know what we're asking and make it clear and make it, and get it out countywide so there's no confusion, so they're not hearing from whoever, you need to be doing this, another person, you need to be doing this, here's what we need to do. And it's spelled out and it's clear, and I'm glad now that it's out. So when we come around in a week or a couple of weeks, or we start hearing, if we hear complaints or whatever, here's what you need to be doing, be sure you're doing that. If it comes back later, you can't be surprised that we are asking you to do this, you know it. So everybody knows that. And then as far as the enforcement piece, we did have bar checks in some establishments in Pittsburgh, and we did send out violation letters Wednesday. We have not heard back. We send them certified mail, so we'll start hearing probably back today and early next week if we have any comments about that. The good news on that is that we now have a system in place. We have a letter in place, so it won't take, even if I'm out or somebody else is out, we'll be able to get those letters out because it's a format, it's just a form letter. We can throw in the narrative that law enforcement, what they've seen on, as they do their checks, and send out those letters. So the behind the scenes part of that is that we're getting people back online from different illnesses that can do the second step of that. So the first step is the violation notices, and then after that, it's referral to the county attorney. We're working behind the scenes on the system to get that up and running because of all the players that are involved in that have been out. So we're back online. I think visit with the sheriff before the meeting. we're gonna work on that second part of it, so that warning letters go out, further violations are sent then to the county attorney. We're figuring out, we need to know the method that she needs that in, the format, and how then to be sent to her for enforcement. That's what we're working on still behind the scenes. We've got the violation letters out, got the system for that, it's ready. Then we're working on behind the scenes how we get it to the county attorney in a format that she can use effectively to enforce it.
Right.
And that's targeted to the businesses, not individuals.
Correct.
If we get to that point where we're still seeing frustration and not having individuals follow, and that's an issue for us, that would be city ordinances.
Okay. So we had done the bar check that had been kind of the origin point of the letters that had just gone out. I'd gotten some questions then, like, what does it look like for non-compliance outside of the bar establishments? Like, what is that process? Because like with the bar one, that's built in, we have a mechanism for that. What does it look like outside of that?
Well, it could and would follow similar circumstances or similar processes.
Yeah, I mean, it has to be even across the board, I mean.
Now, we are, and continue, we haven't continued, or will continue to work with businesses directly if they ask about what they need to do. And we've gone in, I can't even count how many businesses we've gone into now to help them with this process so they can remain effective and continue to operate and meet the standards. And you know, so we've personally talked with multiple. So that option's still available, right? This doesn't have to get to this, really.
I think law enforcement doing the check, that just comes after there's been communication with the business, continued non-compliance, continued concerns, and then that, they officially check it, and that's prior
gives
to
us
sending out the warning letters
the report.
and starting that process. So
So
there's
let's
been
say-
lots of conversation between the health department and businesses that resolve everything. It's
Right.
not a punitive thing.
Right. So let's say with like a retail or a restaurant, it would be similar that like it would result in a police check.
And it has. We've done that in the past already, even before we had the enforcement piece in
Sure have.
place.
Okay.
So,
I want to make sure, also make clear that some of that we're still working through too. So we've done some initial bar checks, but I think visiting with the sheriff this morning, there's some other issues we need to make sure that we're clear on as far as law enforcement doing other types of checks and what they're looking for and what the county attorney's looking for. So, and the sheriff maybe, if he wants to, can say a little more about that. But we're getting there. We're getting the methods established. We're getting everybody on board, and we're trying to get a system set up to where if there is continued non-compliance, we're going to have a way to deal with that and to get it through the proper channels, and eventually to the county attorney if we can't get you to comply. And like we've said before, we're not asking for a lot. And I think the notices that went out, the letters that went out to everybody, show that. Here's what we're asking. Please get that done in your businesses, and you won't hear from us. You won't see us, you won't see a letter, you won't see us in your establishment. But we have to have that. We just have to have that minimum amount of compliance. We have to ask for that. Or, and no one wants to say it out loud, or we end up with broader restrictions in a broader sense. So we're trying to deal with individual issues before it becomes a broader order that none of us want to see. We have to issue that.
All right. Okay. Those are all the questions that I had.
Okay. Thank you.
Any other?
We can hang out.
I just asked from here.
Sir, no.
Would you mind coming up?
Roger Burns, Pittsburgh, Kansas.
Thank you.
And I just had 3 questions on what they were talking about. I was wondering if fever is the most prevalent
Symptom?
symptom. Thank you. And
No, there is that whole list of potential symptoms which can overlap with many different things. And in a lot of cases, we don't see fevers. And so especially in younger people, they tend to have less issues with fever than older people.
let me clarify.
Yep.
Is fever most prevalent in people who show symptoms, not asymptomatically?
No,
Okay.
so,
But it is one of the things that we can demonstrate clearly if a person has or doesn't
Right.
have. And so, the fever check in many systems allows us to check that symptom off the list for sure. Because you can say or not say that you have a cough and really have it or not have it, right? And we may not be able to demonstrate that at a check-in process. But fever, we can clearly demonstrate. And if you have a fever, you should not be around anybody.
but you make a good point, because a lot of people say, well, I didn't have a fever, even though they had many other symptoms and didn't test because of that. So fever does not need to be present to be tested, or to be considered infectious and all of that, so.
Another question is the age group of 65 and older, you mentioned that age group earlier, is it the most hospitalized group, or are you seeing all ages?
So we know that 65 and older has a greater potential for hospitalization and death. We see that in ours. We've had admissions from the 20s all the way to 100. And so it's affected multiple age groups, predominantly the 65 and older, which is the highest risk group.
The reason I asked that question is, when this all began, we wanted to keep the hospitals from being swarmed. And so that's when we went into the lockdown. And I've heard you guys make comments that maybe that was an overreaction. I'm getting nervous. Sorry, I care for you guys a lot. I am my brother's keeper. I'm here for all you guys. My sister-in-law is a registered nurse. So anyway, what I'm thinking is we're shutting down everybody, like the bar scene. I'm 55, I don't go to the bar. I don't know too many people that do. We're shutting them down for people who are probably not going to overwhelm the hospital. That's one of my concerns. And
Well, we're actually not shutting anybody down. We're trying to keep from shutting things down.
I'll make my point about that.
Right. So, the real concern about businesses that are not being compliant, if it's the bars, if it's a restaurant, if it's a retail store, is not necessarily because the people going to that store is going to be the ones that end up in the hospital, but because, when we started to see our spike back in August as a result of a certain age group coming back and being out and unmitigated in bar scenes and party scenes and things like that, those students did not end up in the hospital. But that's the catalyst of what sparked where we are now. And that's kind of what we've been trying to educate all along. And what our concern was back then, when the students were coming and we saw the huge number of cases, is this is going to lead to community spread, and then it's going to lead to the vulnerable population, and then we're going to be overwhelmed in the hospital. And that's the course that we have followed. And so even though someone who goes to a bar and is unmitigated and may get COVID may not be the one that ends up in the hospital, that is contributing to the spread in the individuals that will end up in the hospital. We've seen that. And that was our concern all along.
And like my father's 84 years old, and he's worked his tail off his whole life, and he's wore out. I protect him. He doesn't go to the grocery store. I do it for him. There's ways of protecting older people, and I think we need to focus on that as opposed to, about the bar.
But let me just mention on that real quick, though. But the reason that 8 out of, 12 of our long-term care facilities are affected and have been affected is because the less vulnerable population work there and introduced it into those situations. Grandparents are introduced to it by a lower risk population. There is interaction, and people do, a lot of people have done a lot to try to protect the vulnerable, but the reality is that when you reach the level of spread, and people are going to come into contact with it. And that's what we're trying to prevent. And that's what we've been trying to prevent all along.
So, about not closing down the bars, I understand what you're saying. Last time I was here, my hair was very long. Point is, I don't want to go get a haircut because I don't want to get mixed up into the fray, you know. Say my hair person comes down with it, then I get tied. So I avoid that. Instead of getting it cut every 4 weeks, maybe every 8 weeks, you know, or longer. So that's why, so people are avoiding the businesses, which is hurting the businesses, because they don't want to get tied up in the mess, you know.
Can I answer that?
Yes.
real quick? So I agree that there are people that are avoiding businesses. I will tell you what we're hearing the most on the avoidance is people are not going to businesses because they went in there and they were unmitigated. And so it puts them at risk. And so you're risk stratifying for your family, which is what we've asked everybody to do from the very beginning. And I think all of us do that, you know, to a point. What the challenge is there are many that are not. And that's who you're going to come in contact with in a community spread. And so when we have community spread, we have to do community mitigation. And until we break out of the community spread piece, that's the only way to minimize the transmission throughout. And so I will tell you the businesses, and I've said it here, and I think I can say this without any hesitation. We've gone into Applebee's multiple times to eat dinner. Why? Because I went in there and everybody was masked. Nobody's mask came down. They have hand sanitizer at the front door. They're hand sanitizing between tables. They're sanitizing the tables and they have this appropriate social distancing. So I feel safe bringing my wife and I into that facility and kids so that we can eat. So we see that mitigation is in place. We have frequented that business multiple times. Other places where I walked into and I didn't see it as robust, my risk stratification, because my mom, who's 74, lives with us, I'm not going to go in there, right? I already have enough risk from work. I'm not going to add to it because of incidental community spread. And so if the businesses reformat their thinking to telling the public, we're here to protect your safety, and we ask you to do this, I think the public will go to that facility and shop there versus shy away because of fears of spread, appropriate fears of spread. Okay?
And I can verify that with phone calls I've gotten this week, if they'll call me and say, I went to this business, they weren't wearing masks, or they were wearing masks and they took their mask down, and they said, I got out of there because I was not comfortable. And so they feel more comfortable if you go in and you're making those mitigations, and I think those are the businesses that are, seeing the repeat customers, those that are trying to protect the public.
And then the last question is the cycle threshold for the PCR test. My understanding is if you cycle threshold more than like 17 times, it becomes less and less accurate. So I was just wondering what Crawford County might be testing now.
I gotta be honest, I really don't even know what you're talking about.
Dr. Fauci brought this point up that cycle threshold of I think his number, I don't remember exactly, was 35 or 40. or higher.
Oh,
And I look at that as an amplification of the virus. I don't know if that's correct or not.
So the PCR test, the labs are following the national and CDC standards for testing. And we're using all verified labs. And so I wouldn't think that any one of them would be outside of that standard for testing. Our PCRs are very accurate in the 99% range or higher. And so
Are you asking about concern for false positives or false negatives?
That's where I'm leading with that question, yes. Is there, because it's my understanding, the more you cycle threshold, the more you might find dead virus from years past.
Well, so the majority of people that we are testing still are symptomatic. So not only are they positive from a PCR, but they also have symptoms consistent with the disease. Where that may become a little bit more impactful is if you're looking at asymptomatic people, because you can pick up, the more sensitive the test are those in asymptomatic people, is it clinically relevant that they're positive? And I think that's probably what Dr. Fauci was talking about. I didn't hear exactly, but I read some stuff on that.
And that goes more towards prevalence testing when you're just doing community-based and you test everybody. Will there be some false positives in that they're positive but not sick, positive or already healed, or if it's something else that would create a positive? We might find those a little bit more as we get higher numbers in testing.
That may also impact people that have had the virus and then test positive, either persistently test positive or test positive later on down the road, which is part of the reason why we don't advocate for testing to release people from quarantine or from isolation once they've already been positive, because we have seen people that are no longer symptomatic, no longer considered contagious, and they do still have a positive test, and it can be because it's picking up particles of the virus or dead virus or whatever. And so that has to be taken into consideration when you're looking at the clinical scenario. But again, the majority of the people that we are testing outside of the quarantine release is because they are symptomatic with symptoms consistent with COVID.
And when we're looking at population health, I mean, the one affects the one, we don't want to do that. But what we do want to make sure is that we're protecting the many. And so if we have one or two false positives in our thousands of tests, that doesn't measure as important, honestly, as if we find 10,000 people that were positive in 100,000 tests and they were all positive, right? And so when we're looking at the population, we've got there's a greater good thing. But I will tell you, from what you're saying, from what I understand, and again, we're hearing your version of his conversation, and so that makes it a little challenging.
I don't intend to.
And I don't say that in a bad way. I'm just saying, for us to answer to Dr. Fauci, we don't know what that was. But to try, and what our understanding of this is, we think that's what you're saying. And one, we think the risk of that is really, really low. The labs that we use are all national standard labs and our national standard test. That wouldn't, if there was a dilution thing, if that's what you're saying on cycling, they wouldn't exceed the standard. We're doing symptom-based testing mostly, meaning people that are sick get tested, they're positive, we believe they're positive. And so it applies, we're applying a verification standard to most of them already anyway. Does that make sense? Does that answer your question?
Yeah.
Yes.
About the release at that point. And along the lines of one false positive in 1,000, I don't know who said it, but as far as guilty people, it's better to have 10 guilty released because they couldn't prove, as have one not guilty person incarcerated forever because they were that's one way to look at it. But anyway, so I've always said I'd like to be here when they could be here because I'm very worried about the vaccines. I'll just be honest with you. Evil men exist. If you believe in Jesus, you know that evil exists. I believe Bill Gates is evil. And I can show you videos of him speaking that will prove my point. I'm not going to do that today, but if you ask me to, I certainly will. One reason I think he's involved in this is in computers. I told them before, the binary code of a computer is very much like a DNA of a person. So he's in, it's in his ballpark. He's not a doctor. So why he's worried about our DNA, I don't know. But these vaccines, maybe you could explain to me, I don't know the difference between RNA and DNA. My understanding is RNA carries proteins for the DNA. I don't know. It's very complicated for me to understand.
Yeah.
But these vaccines are going to go in, they're mRNA vaccines. Moderna says it right in their name, mod-RNA. And I don't want them tinkering with my DNA because, as in the days of Noah, he flooded the earth because the only pure generation was Noah. So he flooded everybody from there. First off, I want to thank you guys. You guys got a hard job, and I do appreciate it. And
We're
you guys
very
do.
blessed to have them.
Yes, you are.
Agreed.
And I know you guys have the best intentions for our county, so I'm not, but I'm very worried about the doctors and nurses getting the first round of vaccines. If there's a viral shed from this vaccine, I've heard one person suggest that, I forget names because I listen to some weird stuff as I'm driving. I'm talking professionals, I'm not an Alex Jones conspiracy person. I listen to doctors. And maybe one doctor suggested that nurses and doctors scatter the vaccine so that if they become sick, basically, you've still got others that have not received it yet. And so anyway, how Bill Gates involved with the FDA. The FDA also approved hydroxychloroquine. Now, they didn't approve it for treatment of COVID, but they also haven't treated it for a lot of other uses that we do use it for. Why have we not? And there's Dr. Zelenko. I don't know what country he's from. He's a foreigner. But there's a Carla Dean Graves from Kansas City, Missouri, who, when this all first started, they started doing their research, and they found out that hydroxychloroquine is very good against viruses. And then all of a sudden, the FDA comes along, or CDC, I don't know who, and said, no, that's not approved for this. But yet they've treated people in the hundreds of thousands, in other countries especially. India started prophylactically treating all citizens because they knew with their population that they were going to be in trouble if it hit there.
So you got a lot going on there.
Yeah.
Can I respond a little bit so we can piece this out? Dr. Dean has another meeting. that she
Yeah,
has.
doctor, if you guys, I
Well,
know
I
you're busy.
don't mind answering some quick questions with relation to that.
And I might just add before I leave, though, the vaccine thing, and vaccines in general can sometimes be a controversial issue for people. I do think that it is, because some of it is new technology and then there's also the emotion of just COVID in general that's linked to that. I think it is important to try to get that information about those vaccines in a very readable, easier to understand kind of thing. So I'm going to look to see or help put together maybe something on vaccines, because we're just now starting to talk about this. And even though this has moved very quickly, thousands of people have already received the vaccine through the trials that they've been doing and the studies that they've been doing, tens of thousands of people. So our
And to that
healthcare
point-
professionals will not be the first people to get the vaccine. They will be the first outside of the trials to get
Right.
the vaccines. So
Right.
that's important to understand that there have been already lots and lots of people vaccinated with these.
Europe is well into their vaccine program now, a few days into it.
And side effects are already starting to show over there.
Right, but, so, first of all, I'm gonna go back to the beginning about the DNA. You are coding into your DNA as a child when you interact with dust and you become allergic to it, right? You're coding into your DNA every time you eat something. All of that becomes a part of your immune system. And so, the vaccines, all vaccines work the same way to help your body develop an immune response to what we're trying to fight. As far as RNA versus co-proteins, they're all pieces of that anyway. All of the vaccines are, right? And so this is a little bit different way. It's well vetted by organizations that are looking out for all the good, including themselves. They don't want to develop a vaccine that's going to cost them their whole company in a year. Hang on.
Okay.
And so, as far as how we're managing this in the medical system, we will not go in and vaccinate every doctor, every nurse on the same day. And expect that that's going to be good. So it is a phased approach that we're doing with all of our systems. And we're, again, not the first system to do this. This vaccine is already in place. And some of this gets outside of the scope of what we need to be doing here. But the hydroxychloroquine issue, yes, we do billions of doses for malaria every year. And it's effective in that. But you don't take Tylenol for diarrhea, right? I assume. You take Tylenol for fever and a headache.
Yeah.
Right, you take acetaminophen for fever and a headache. You don't take it for diarrhea. Because that's not what it's made for. That's not where it's the highest functionality. And so, when we're talking about medicines and options for treatment, we want to have a reasonable assumption that there's going to be benefit. Otherwise, it's all risk. And that's what they were trying to manage with that. And so, it gets into old business, not necessarily conspiracy, just people trying to figure out what was working. Some of the drugs early that we used, we said are dangerous. And then 4 months later, we realized that we were using anecdotal evidence. And anecdotal evidence does not make it true, right? It just means in that one thing, something else happened, and we assigned true to that falsely. And so we have learned a lot as we've gone along, which is added to the challenges for the community as we try to figure that out. Because what was once bad is now good, what was once good is now bad. But that's because we have learned and adjusted as we went along in an effort to make sure you're the safest that you can be. And if we are resistant to change in the medical field, we will harm people. The only constant is change, right? And you have to be open to looking into that. And so that's what we've done all along, utilizing current science and current data, not anecdote, and being open to the possibilities of new as we move forward. And carefully monitoring what's going on. A lot of smart people out there trying to make sure that we're all protected, you and I included. And also you and I included in making sure that we're protecting people, right? This whole group that's in here right now is looking out for the well-being of our community. And that does include you, right? And so, great questions. Some of that relates, some of it doesn't, but we're all looking out for the greater good of the community.
Would you agree that most medicine studies?
Sir, the doctors have to go, and we've tried to answer as many questions as possible. thankful that, you're concerned, as everybody should be, but I'm sure the doctors.
So you don't care if 4 years from now
No,
you
sir,
come down with cancer?
I do care, I
Okay.
care greatly.
Because these tests have only been done for 6 months.
Yeah, well, you don't have to take the vaccine. if
That's
you
why I'm
want.
here, because I know it's coming. You're making us all wear a mask right now.
You bet.
No, there's never, has been said, nor will we say, that you have to take a vaccine.
Okay, my point is, my company is gonna make me take one. Why I'm here is, I want somehow to pass a resolution that Walmart can't refuse your service for not having one. Home Depot, my job can't fire me for not having a vaccine.
You can't force a person to use an emergency use authorization, anything. No company, no organization, no government can force anybody to take something that's in emergency use authorization.
Okay, I will agree to leave right now if you will.
We're not asking you to leave.
No, if you'll agree that if this conversation ever comes up, you'll give me time. I just happen to be off today. But this is a discussion, I know the forced vaccines are coming. I seen this on day 2 of the shutdown. It's like God spoke to me and said, we're in deep trouble.
Uh-huh.
And I'm not kidding you.
As the health officer for the county, that would have to go through me, and we're not
Okay.
forcing vaccines on anybody.
Okay.
I will encourage it, because, and I will tell you, almost 100% of our doctors have stood up and said, I will take the vaccine. And these are the science people that have looked into the data and believe in it enough to risk themselves for the protection of the community. That should say something to you more than your radio program that you're listening to when you go to work. Well, and I'm being serious about that, because it's the people that you know, including me. They ask me, are you going to take the vaccine? As soon as they can stick it in my arm, I'm going to take it. Yes, without hesitation, because looking at the science and the data, I believe in that, and I believe it's safe. And I have a lot to risk.
Yeah, you do.
And I'm not talking just the financial stuff. I have kids, I have a family, I have a community that I love, all of those. And all of that is at risk if I'm wrong. Of course, we take risk every day, right? I mean, just getting in your car is a risk. But I believe that it's safe, effective, and for the greater good. And so I will take that without hesitation. And by and large, almost all of our doctors are. And that should say something to you about what we believe in that.
Are you aware New York City's starting legislation for mandatory vaccines?
Are you aware that we're in Kansas?
I understand.
Okay, so I say that because people are always directing me to what other countries, other states are doing. But my redirection is, we don't live in New York land.
Okay.
We live in Kansas land. We don't live in CDC land or India land. We live in Kansas.
Okay.
And this is the discussion that is going on here. And you cannot legislate emergency use authorization drugs to be mandatory. It's not legal. It's not
Okay.
possible.
I thank you very much. I'm glad I'm done. That's all I wanted, so,
Thank you.
thank you. I do appreciate you guys very much.
Well, we appreciate the questions. We do.
Okay, have a nice day. Thank you.
Thank you. All right, anything else?
Great discussion.
Yeah, I'd like to take a 5-minute recess.
Yeah, that's fine. Janice, is that all right?
Is that all right,
If we
Janice?
do a recess before you go?
Mr. Chairman, I so move we take a 5-minute recess.
Second.
After this.
Oh, you're doing this. Oh, my God.
To actually kind of reconnect or reinitiate whatever's got to do, handshakes and stuff like that. go ahead and have those, and he's gonna talk about them, I think, Tuesday, actually, but he brought them with us, so good time to hand them out.
How you doing, Jim?
I'm good, how are you, Jim?
I'm good.
We're back online.
We're on. Okay. Brief, I'm this long.
Okay.
Janice, are you gonna talk or are you gonna?
I'm gonna be this long,
Okay.
I think.
All right, Crawford County Commission back to order. Janice, did you want to provide us with the Health Department update?
Yes, I just want to let you know if you've noticed the new little temperature thermoscan downstairs.
Yes.
We shared that with you all. We also have them in the health department. They can get a little bit sassy and tell you don't have a mask on. So, but it is very beneficial because it does have a database, and I told my staff, although you're not writing your name down here, I am checking to see that you're going through. So it's very, they've been very helpful, I think, to us. The other thing that we are going to maybe help supply you all with is hand sanitizer. This big bottles that your employees can put in their pockets, and that we've got a lot that's being delivered today. Yeah, I should have got that about 10:15 today. It was on its way, so I should have got that maybe. So we're going to be sharing that with, the hospitals have said they would like to have some. We'll be sharing that with everybody as well. The final third thing that I wanted to talk to you about is we are gearing up for the immunization piece of this, and we'll be looking for assistance from cities probably, and as well as, retired medical people that would like to, help administer vaccine or anything like that. But we're just beginning stations. I'm supposed to find a lot more out this afternoon. Sometimes they tell us that and then we don't find out too much, but I expect to have a webinar this afternoon that they're going to update us quite a bit of that on that. We are definitely, a provider enrollment has been accepted and approved. So we're ready on our end. I'm just praying it doesn't come during Christmas week because nobody's going to want it during Christmas week. So I'm hoping that they will postpone that till the following week because nobody wants to take a vaccine on Christmas and nobody wants to work on Christmas, but
Sure.
hopefully. But we want to get it out there as soon as possible.
Absolutely.
And we want the best response, and we got to use it, in a time frame, and we've got to be really on that. But anyway, we're gearing up, so just to let y'all know, okay?
Are we good to go on coolers and stuff like that, Janice?
Yeah, we're good to go. We have some. We also are getting some from some state funding. Vaccine's supposed to come on dry ice. We're supposed to be replenishing that in 2 or 3 days and making it so that it can last 5 days when we get it. So
Oh, wow, that is a short timeline.
And we gotta give it.
Wow, right, yeah.
I don't wanna waste one dose, so we're gonna be giving it. So,
Okay, so to bring Samantha in here, have you guys been working on communicating?
We haven't got that far
To the
yet.
public.
First, I want to get into, we have already had some people call and volunteer and say, hey, we want to help, and that's great, and we're taking their names and numbers. We've had also some concerned agencies, dialysis units and, assisted living, not assisted living, but for those that have a mental development problem, they've asked, if they could be put on a list as well and get it as soon as possible, which I understand because they're caring for those. So, the state will send us out a mandate, we will follow that mandate, and I'll have to tell you right here, real very quickly, is that when state sends us down that mandate and you make one exception to it, just one, you're done. Because if you make one exception for this person, you're gonna make exception for this person. So we are gonna have to follow that
No
mandate.
end to it.
Yeah, so that will be that was a big issue in H1N1, was always people wanting favors or people wanting, well, I think I qualify because of this, but according to CTDC, or the KDHE guidelines, they don't, and we can't, so that's where y'all probably be getting a lot more feedback, is that they wouldn't give me a vaccine. Well, according to the structure, this is what we needed to do, so, okay? That's it for me today. Thank you, guys.
Cool.
Thank you,
Thank you,
Janice.
Janice.
Have a good weekend.
All right, moving on. We do not have any elected officials here, so I guess we'll move on to new business. Dawn?
I don't have anything, sir.
All right, Jim?
Okay, so when we were on break, I handed out copies of what I have to present this morning for new business. The first item is a kind of cleanup resolution from Tuesday's meeting, 2020-014. On Tuesday, our zoning administrator, May Smith, presented a replat for approval, filed by Todd Trowbridge, first replat of the Trowbridge Estates second edition. And as part of that presentation, the commissioners approved to move forward with that. And the official process of moving forward is the resolution. So the resolution does two things that we used to do, was two separate resolutions, but we've decided to streamline those a few years ago, so that we do both the change in zoning that's required and then approval of the plat. So there's you'll find the change of zoning, normally that's from agriculture to a residential type, and then the actual approval of the plat. We just melded those into one resolution. So that's what this does. Section 1 approves the subdivision on page 2, and then Section 2 approves the zoning change from agriculture to suburban residential, is what it's called, so.
Is that typically what it is for these kinds of additions that show up out in the county?
The way that our county is set up, and this was done several years ago when we rechanged our zoning, the old book, the old little green book, was the old district method. So you had a commercial district, you had an industrial district, you had a residential district, which is great in cities because they're laid out, it lays out perfectly that way. You have a downtown, you have an industrial park, you have, in the county, not so much. So we went to a conditional use method where basically everything is agriculture, except for our village districts, which are the unincorporated areas. So it's a base agriculture zoning with conditional uses, or like when these subdivisions come up. So if I want to run a business out of my house, or if I want a business use, then I have a conditional use to change that to a commercial use by by parcel of land, not a broad area like other zoning. It doesn't fit as well in the county. So it changes, these usually change anytime we have a plat from agricultural to some sort of residential
Gotcha.
zoning.
All right. Any other questions?
Mr. Vice Chair, if there's no questions, I'll move for resolution 2020-014.
Second.
How many you need, Jim?
2, please. Thank you. Now, the second item that we have is Resolution 2020-015. It is the annual resolution that we review and adopt regarding generally accepted accounting principles, the GAAP accounting that does not applies to businesses and corporations, but not as much to counties and cities because we follow governmental accounting standards, and they're looking for compliance with cash basis law, with the budget law. So they're looking at municipal statutes and then are making sure that we are following those statutes as they review our spending and our deposits. So it's a different method of accounting, governmental accounting. They also do federal audit, which is totally separate from general accounting principles. So we're allowed to waive that by statute. I know Terry has said that that's something he looks for each year to make sure that we are doing that, which saves us loads of time and money and probably staff that we would need to hire to actually follow the regular accounting principles. So it does an accurate job of what it needs to do for a county.
Okay. Any questions?
I have none.
I will move for resolution 2020-015.
Second.
Thank you. Now, the third item that I'm on the agenda for is something that will just be an informational piece today, and then we'll approve that if the commissioners are comfortable on Tuesday. So Commissioner Blair has been aware of discussions with Fire District 3 and the City of Cherokee to combine for fire services. There's several different ways to do that. What we decided on visiting with the city, the easiest way to do that would be through a contract. Whether it's allowed in statute where the city would contract with the district to provide fire protection. So that contract is in front of you. What we'll have is the city does have some equipment. The city also has a building. The equipment will be transferred over to Fire District 3. The building will remain in the city's name, but the fire district will be able to use it, and we'll pay for the utilities and such. And then any of I think all of the firefighters were joint members of both the city and the district. So that'll be an easy transition, as well as also there's some information in here about firefighters relief fund, which will transfer from the Cherokee portion of that firefighters relief fund will be able to be transferred into Fire District number 3. So it's a seamless move. What made it easy was when we found out that residents in Cherokee already pay for the fire service, and they've been getting the fire service. So we didn't need to do anything special on money-wise, so that made it easy to contract. So the money's already taken care of. a contract for the service. The city of Cherokee has already approved this contract. Fire District 3, I believe, will be meeting at some point this weekend to approve. And then hopefully, I'll hear from them Monday and make sure if they've approved that, then we can go ahead and visit it Tuesday. But I just wanted you to have a copy of it, to be able to take a look, and then we will have that Tuesday for the meeting.
All right, okay.
And that's all I have for new business.
All right, thanks, Jim. Tom?
No, sir.
I do not have any new business, I don't think, so moving on to old business. Don?
The only thing that Mike mentioned, Michael Healy had brought an annual report for the community mental health services for Crawford County, and I gave you all a copy of it. He's going to talk about that Tuesday at the meeting. Is on the schedule, on the agenda for discussing that with you guys. And anyway, he wanted you all to have it to look at this weekend or whatever if you want to, and then you'll have more discussion on it on Tuesday. I want you to make sure you saw that out there and know that it's available for you. That's all I had.
Okay. Jim?
Yes.
I wanted you to know that yesterday we sent in the December reporting for the Spark money, which is actually November expenses from the 1st to the 30th. It was due yesterday, and we have that submitted. I know Randy's working hard here to round up some of the last county spending, but I know visiting with Greenbush yesterday and we had the report from Mike on Tuesday, but we have a lot of, we're getting down to the very, very few receipts that are left to make sure that we've proved our spending. So they were pleased with that. Even though there's a couple more reports, they'd like to have everything wrapped up by the end of the month. Have the money spent, the receipts in, and then we could get that final report in. It's early January. There's another report that you could turn in, I think in February, but we'd love, Greenbush is wanting to get it wrapped up, and we are too. So there was a large feat that we've accomplished in a short amount of time, and we're at the end. And it's been a successful. I don't think every county's had the success that we've had, and we were real lucky with Greenbush and what our people, also our employees have been working real hard. I know the health department and mental health and district court and Randy, getting everything that we needed to have in to prove the spending. So it's we're just about to the finish line on that. So yeah, that's worked out real well.
Good. Awesome.
That's all I have.
All right, thanks for the update. Tom?
No, sir.
And I do not have any old business. So for future business, December 15th, 2020 at 8:30 a.m., there's a work session to review and sign December mid-month bill and payroll vouchers. On December 15th, 2020, Devin Gorman, Executive Director of Crawford County Convention and Visitors Bureau, and Blake Benson, Executive Director of Pittsburgh Area Chamber of Commerce regarding CVB Chamber contract. December 15th, 2020, Michael Ealing, Executive Director of Community Mental Health Center of Crawford County regarding CMHCCC operations. December 22nd, 2020 at 10 a.m., there will be a public hearing on the 2020 Crawford County budget amendment. And also on December 22nd, 2020 at 10 a.m., there's a public hearing of the 2020 Crawford County Fire District Number 3 budget amendment. No announcements. Is there any other business to come before the commission?
Mr. Vice Chair, if there's no further business, I'll move we adjourn.
Second.
Wait waited until I saw you bang the gavel on the last